Thank you for joining me today. In this video, we are going to talk about mental health common symptoms and how you know this patient is having or this person is having a common mental health symptoms. Please prescribe and join me. Common psychiatric symptoms are the subjective experience and observable behavior that indicate the presence of mental illness. These symptoms will tell you this person, when you see them or when you see their behavior, you can tell this person has a mental illness or mental disorder. Although these symptoms are not diagnostic by themselves, they promote essential clinical information and they provide essential clinical information during the psychiatric assessment. It will help you to know that they are having symptoms. Clinicians must recognize these symptom clusters to determine their severity, duration. You will interview the patient and you will ask them if they can answer the questions, or the family member or the caregivers, how severe they are, when do they begin, how do they affect the patient function, distinctive, what kind of condition they signal. Are they from medical conditions, these symptoms? That's what you want to figure out. Are they caused by medical conditions, neurological conditions, or substance-induced disorders? Before you diagnose them with mental illness. So through evaluation include assessment of the symptom onset, precipitating factors, what caused the symptoms, when do the symptoms begin, associated medical conditions, what medical conditions have been associated with these symptoms, medication used, if they've been using medication before, if they had these symptoms before. Is this symptom caused by the substance use or medication use, or developmental history, or psychosocial stressor? Are they having a risk to themselves or the others? For example, mood symptoms. Mood symptoms involves disturbance in the person to sustain emotional state. So the mood symptoms involve disturbance of sustaining emotional state. For example, depression will cause the person to have sustained sadness or depression mood. They feel they will tell you that they feel sadness, hopelessness, so guilty. Those are the symptoms for depression. Fatigue, low energy, social withdrawal. So if you see those symptoms, you kinda know this person is depressed. But before you judge that this person is depressed, you want to know what caused it. Why are they depressed? Is there a medical cause of this depression? Is there a substantive withdrawal of this symptoms? What is causing the depressed mood? If they are manic, and the common disorders that cause depressive mood include major depressive disorder, persistent depressive disorder, bipolar disorder. Those all can lead to depressive mood. However, if they are manic, some of the manic symptoms is elevated or extensive mood. They are very happy, they are very energized, they are also irritable. It's the opposite of the depressed mood. They have a high self-esteem, they have a grandiose self-esteem, they have a decreased sleep, increased goal-directed activity, excessive talkative, racing thoughts, poor judgment, risk-taker behavior, and manic disorders. Most common diagnoses include the bipolar 1 and bipolar 2 disorders. Anxiety symptoms include restlessness, worries, muscle tension, feeling of on edge, difficulty concentration, fatigue, sweat, heart palpitation, and these symptoms are associated with general anxiety disorder, panic disorder, social anxiety disorder. All these disorders have anxiety symptoms. So when you see the symptom and you see the person is anxious, you want to assess what is the causes, what is the reason behind the symptoms. Cognitive symptoms. Cognitive symptoms affect thinking, memory, and executive function. Common symptoms include poor judgment, memory impairment, confusion, difficulty making decisions, slow thinking, disruptive thoughts and behavior, slow thinking, distractibility, poor organization, executive dysfunction. And then you want to screen, do they have a delirium? Are they having a major neurocognitive disorder or dementia? Are they having a ADH disorder? You want to screen if they have a depression disorder or schizophrenia disorder. Psychiatric symptoms include hallucination, and the hallucination include auditory, they are hearing voices, visual, they are seeing something that's not there, tactile, they are seeing bugs are going to their skin, or something is touching their skin, they smell something is not there. It also gustatory. Delusional, it includes delusional, and the symptoms of that delusion is persecutor delusional. Somebody is going to persecute them. They are having a grandiose, they are bigger than other people. They are religious delusion. There's a religious delusion, somatic delusion. reference delusion. Disorganized thinking is one of the symptoms of psychosis. Symptoms: disorganized behavior and thinking. Behavior symptoms include agitation, violent aggression, impulsive social isolation, negative, self-negative thought, self-injury behavior, non-compliant to the medication. Those are behavior symptoms. And what cause these symptoms? Common diagnosis that cause these symptoms include personal disorder, bipolar disorder, psychiatric disorder, substance usage disorder. Those can cause these symptoms. So you want to rule out which one it is. Sleep disturbance. What causes sleep disturbance? What causes insomnia? Sleep disturbances, common symptoms are insomnia, hyperinsomnia, early morning wakening, difficulty initiating sleep, nightmares, night terrors, reduced need for sleep like a manic. What affected sleep? What kind of diagnosis that can affect your sleep? Some of the diagnoses that can affect sleep include depression, anxiety, PTSD, bipolar disorder. They have symptoms that tells you their sleep is affected. Appetite and weight changes. Person come to you and say, hey, my appetite, I don't have no appetite, I am losing weight. Or they are saying, I have a lot of appetite, I'm always hungry, my weight is changing, I'm gaining weight. You wanted, those are symptoms. So increase appetite or decrease appetite or increase weight. Because if your appetite increased, your weight will increase. If your appetite decreased, your weight will decrease. Binging eating, bargaining behavior. What diagnosis then can lead to those appetite and weight? Most common disorders that lead to appetite changes and weight changes include depression, anxiety, eating disorder, and bipolar disorder. Somatic symptoms. Somatic symptoms: patients may report that they have headache, fatigue, GI complaint, chest pain, short of breath, muscle pain, dizziness, chronic pain without clear medical condition. So you want to screen, are they having an anxiety disorder, somatic syndrome disorder, or depression disorder? Obsessive compulsive symptoms include obsession and compulsion. What are the obsession symptoms? Obsession symptoms include recurrent, intrusive thoughts, urgent image that causes remarkable anxiety. So there's a flashbacks, images that cause remarkable anxiety, recurrent, intrusive thoughts, urgent, and those are not easy, they are scary. Example of these symptoms include contamination fear. Those are obsession. They are fear of contamination. So they want to wash the dishes, wash their hands, wash their feet, take a shower. I had a patient who take a shower every hour. They want to take every shower. So we have to stop them because they are obsessed. It's not normal to take every hour shower. 12 hours shower, shower, shower. When they don't want to even sleep, they want to take a shower. They want to cleanse. So you will educate them. You had a shower 1 hour ago. You educate them to sign. You want to take a shower, sign here, sign the time. They take shower, and then you show them. This is the date. This is your signal. You had a shower 1 hour ago, 30 minutes ago. Aggressive thoughts. They have a thought of aggression. They obsess with religion or occupation. Preoccupation. So they always brain. It's okay to pray, but it's obsession. It's not normal. You are not working. You can't work. You can't sleep. You can't eat. You are always brain. So it's obsession. Need for symmetry, stimulation. They want to always have that. And the compulsion is repetition behavior or mental act performed to reduce anxiety. So compulsion, because OCD has obsession and compulsion. So if they have a compulsion symptoms, that means they are anxious and they want to reduce the anxiety. So they want to do that so they can reduce the anxiety. They are anxious, so they want to take action to reduce that anxiety. And that compulsion include excessive hand washing, checking. They want to check. They want to check the door is locked. They want to check that their clothes is clean, their hands is clean. They count again and again. Ordering. They want to order because they want to reduce the anxiety. They order. They want to order and reorder and recount and recheck. Repeat prayers. They repeat. As I mentioned, they want to pray again and 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 pray again. Because they are anxious, they want to feel comfortable. So they want to do this so they can reduce their anxiety. Trauma-related symptoms. Symptoms that caused by trauma, experience of a trauma, include flashbacks, intrusive memory, nightmares, hypervigilance, startle response. You get scared and you just jump. Emotional numbness, avoidance of that trauma, irritability, sleep disturbance. And common diagnosis is the PTSD. Substance-related symptoms. You want to learn these symptoms so you can know these symptoms caused by these symptoms is caused by those illness. If you know those symptoms, you kind of know what caused it, but you want to also investigate. You want to rule out or rule in what caused it. So substance-related symptoms include intoxication, withdrawal, craving, tolerance, continue use despite the harm. You will see somebody, for example, intoxication. I had a patient who cannot tolerate with the withdrawal. They want to be high all the time because that is the only way they can feel comfortable. So they are intoxicated, the way they talking, and there is a symptom is that you can see this person is intoxicated. Withdrawal symptoms like alcohol withdrawal, you sweat, heart racing, the vitals will change, the blood pressure will be high, the heart rate will be high, they are sweating, they are having a tremors, they are, if it's too much, they hallucinate, or they are having a delusional or agitation, irritability, craving. Substance use symptoms include craving, loss of control, that you know this is harmful, but you cannot control your craving. They will come to the hospital, they will have a plan to, they will go through the detox and educate and set up the follow-up appointment, and then they will not show up the appointment, they will relapse and come back because that is losing of control. Continue use despite the harm. They know they have a liver damage, pancreatic inflammation, they lost their job, they lost their family, they lost their loved ones, children, husband, and it still continues. It still continues drinking, it still continues using drugs, it still continues because they lost the control. Impaired function include the work, school, relationship, family, responsibility because of that. The substances that can lead to that include alcohol, opioids, stimulants, cannabis, sedative, hypnotics for sleep. Sometimes when they come to the hospital, some of them, they will demand, oh, I wanted stimulant, I want to talk to the doctor, I want to talk to the doctor. And then when the doctor shows up, how can I help you? I want you to prescribe me this medication. That is the medication they are addicted to. So, and then they will get agitated and upset and violent if they don't get that medication. And that is why they're in the hospital. Symptoms that leads to high symptoms, self-harm, SI or HI, have a high priority symptoms is a positive thought of death, active SI, plan, tent, previous attempt, cutting, burn, hopelessness, feeling of like burnout, pervert behavior. All these symptoms will have a high priority of safety. You want to assist the mental status, You want to assess their appearance, behavior, speech, mood, affect, thought process, thought, perception, cognition. Symptom clusters, not isolated symptoms. They guide differential diagnosis and treatment plan. When you see the symptoms, those will help you to have differential diagnosis. You want to have differential diagnosis of what are the diagnoses that can cause these symptoms. When you see these symptoms, clusters, you can know what kind of diagnosis can cause these symptoms. And you want to rule out the diagnosis that don't have. For example, if they are anxious, there is a mental health disorders that don't cause anxiety, mental health disorders that don't cause obsession or compulsion. So you have to rule out or rule in the diagnosis. Always assess the symptoms onset. When do this begin? When do this symptom begin? How long these symptoms have been going on? How frequently you feel? Do you feel every hour, every minute, every day? Is this hourly, daily? How often you feel? The frequency of the symptoms. You want to assess how severe it is. Debilitating symptoms, mild symptoms. You want to assess how severity of the symptoms is. What triggers the symptom? What caused this symptom to be like that? Impact of the function. How this symptom affected person function to work, to have school, to have a relationship, to have a house, to have a stable routine, normal routine. First, you want to rule out medical cause of the symptoms. Medical, not psychological, medical causes. You want to rule out that. Then you want to rule out the neurological cause of the symptoms. And then you want to rule out the medical or substance-induced. Are they taking medication that cause them anxious? Are they had substance that cause them to be anxious? Causes before attribute the symptoms to primarily psychological disorder. So psychological disorder will be the last, but you have to rule out if they have medical, neurological, medication, or substance causes. You want to evaluate every patient for SI, HI, psychosis, impaired judgment. These require urgent. If the patient is psychosis, they need to be hospitalized. If they have impaired judgment, they need urgent interventions. Use validated rating scale. Rating scale of depression, rating scale, anxiety, manic, psychosis, cognition, substance use measures alongside with clinical interventions to promote the symptom severity and treatment response. Thank you for joining me today. Please subscribe and join me again. Thank you.